parts and all of the roles or aspects of their health and disease that they're living inside of them. And there's a key part that I try to access, which is really important to isolate out, which is their true self, which is who they really are, which is their essence, which is their connection to spirit, which is pure and whole and healed just the way it is, but it kind of gets buried underneath a lot of stuff. Okay, so I'm going to, bear with me, I'll do 2 psychodrama experiences, or I did playback and I did some other things, so I'm emboldened to do this and to share, you know, the connection, the mind-body connection, the childhood connection. So, and I speak for myself as well. I'll stand over here for a second. Imagine that we all start as a seed, right? This pure seed ready to sprout. And if we're given water, and if we're given food, and if we're given sunshine, we just become who we're meant to be, right? But some of us were not given water and sunshine and food. Some of us were not given love and space and care. Some of us were given worse than that. Not only didn't we got a lot that we didn't want that we got, right? So instead of growing up like this, we grew up like this, because we had to survive, and we had to play this role, and we had to protect ourselves. And then we had to go like this, and then we had to go like that. And then, by the time we're 25 years old, we're twisted in 1,000 different places, and we're going into a doctor's office going, my back hurts, or I have this disease, and, fix me, and do it in a week. But it's all connected. So another way to understand this is I teach at a senior center, and most of the people there in the 60s, 70s, they have arthritis, chronic degenerative disease. It's not that there's a cure or the answer, but each person can be engaged involved in their healing. But when I share with them, I usually grab bags from people. Just imagine I'm carrying all these bags. I say, if you walked into your doctor's office, you went into your rheumatologist's office, because they all go to the rheumatologist, and you carried your bags on your back and your books, and you were walking around with this, right? And you said to the doctor, my back hurts. What do you think he'd say? If he's a smart doctor, he'd go, put the bags down. But a lot of people are walking into their doctor's office carrying bags that to their doctor is invisible, to them is invisible. They're carrying a bag of resentment. They're carrying a bag of being abused as a child, or coming from an alcoholic home, coming from a home where there's mental illness, or there's a death of a spouse that they've never fully grieved, or they were in a divorce. And it's not processed, it's not felt, it's not released, it's not seen, it's not experienced. So here's where the connection to psychodrama from my standpoint humbly state, because Louise helped me. I just asked for some tips on the teachings in Reno, and she gave me a quote that I think is really helpful. And this is what Reno said: the body remembers what the mind forgets. So all I do when I ask people to look inside is help them remember what's happening. And if it's their body that's carrying it. So I see patients who may be seeing their therapist, doing great work, but not connecting it to the disease in their body that's carrying it in a way that it can be integrated, because it's holistically oriented. We're not a body and a mind and a spirit. We're not even a body, mind, and a spirit. We're a human being that's a complete integration. And just because in our education we separate it out doesn't mean that that's who that human being is or how to treat them. So I've attempted in my career to see the whole person and to treat the whole person. So I want to share with you an imagery experience with a second patient. And here's the second question that I got from being on a vision quest in Southwest Canyonlands, crying for a vision for 10 days. And the question is, am I willing to listen with the ears of my heart to the other voices of myself speaking? Because that's pretty much what I've realized is the healing power. And the question, where's the healing? What's healing in psychodrama, in the work that's done here? I'm not answering that, I'm giving that question. But for me, it's what people need is to be listened to. The healing for me this week, I told my story when I would share. I told my story in Why We Don't Speak to Veterans, when I told about my father and his time in World War II, which I'll share in a moment. Or playback theater, just sharing my feelings in the moment. Okay. And people listened, and they cared. And there was no, have to fix it, have to change it, have to make it better. There was simply, listen to me, hear me, and care. And so, the listening, but we're not listening to ourselves because we're bringing our pain to somebody else and saying, do it to me and do it for me. But we're not trained, generally speaking, because a lot of training I've done, I didn't learn it. And therapists don't necessarily learn how to be present with the pain of another. It's more, what technique do I do about doing something about it? We need to do a more integrated integration of those things. So nothing I'm saying is meant to be the be-all and end-all about healing or curing, better than anything else. It's an ingredient that for me is the missing ingredient often in the healing journey for people. Kind of like the salt in the soup. And for me, it's consciousness. Einstein said you can't solve a problem with the same consciousness that created it. And when you help people change how they look at things, their relationship to it, it changes. Instead of engaging fully in how to get them out of it, it's more how to help them be in it. So people come to me to get out of their pain, and the healing is helping them look inside to open to it. To speak about my dad for a moment, I shared this in a very powerfully healing and beautiful session that we had in, it was Why We Don't Speak to Veterans of War. And my father was in World War II for 4 years rather, in France. And he suffered from PTSD, and in some form, we're all suffering from PTSD of our lives, of not getting what we want and what we needed when we wanted it and needed it. Long story short, he had nervous breakdowns from his post-traumatic stress disorder. He had heart disease, and he died on the operating table, age of 54, having bypass surgery. This was before I became a doctor. And the lesson for me was, what were they bypassing? In all the years that he was in the healthcare system, I don't know that even when they knew what happened, they didn't get to the core of his being and the pain that he was suffering from, that I saw in his eyes, and I dealt with it in different workshops throughout the week for myself, the terror that people touch, that we see in someone's eyes, in our parents' eyes, that they don't process, that we're having to touch for ourselves. And I had a dream, and this is another thing of how I came to be this kind of doctor, to speak to you this way. And the dream I had recurring after my father's death was holding him in my arms, and they came to take him away. And in some forms, I'm imagining, because later I found this out retroactively, that, or retrospectively, paranoia is part of breakdown, except they trust the family, they don't trust the people coming to get him and the people out there. And so I'm a young boy holding my dad in my arms, and they're pulling him out of my arms, and I'm screaming, this is a dream, leave him alone, he only needs to feel his pain. Leave him alone, he only needs to feel his pain. And that's, to me, the essence of the healing. We help people tell their story and feel their pain in a healing way, not in a recycling way, not in a wallowing way, not in a dissociative way, but to see it, to feel it, to be present with it, to embrace it, to remember it. Because we push it away. We exile it. Okay? We all, in the workshops, without divulging, we all want to be and express our true self. And I feel kind of blessed. It's a healing for me to stand up and share with you one of the other workshops I did, my passion and my purpose, which is to be here and to share this in a way that hopefully is of service. So I did a guided imagery with a woman who came in who was obese. She'd been struggling with weight her entire life. She came in, she needs to lose weight. She had clinical issues. She heard that I'm good at weight loss in terms of helping people. But I actually help people with weight loss without ever talking about weight. or diet or nutrition or exercise, because that's not the issue usually. If they